Good morning, Mr. Romero. I am Glyza Alilin Hernandez, and I'm going to show you my performance in assessing the integumentary system. First thing you will do is to identify the patients by simply asking their names and their birthday. Sir, may I know your name
James Hall,
and your birthday?
February 16, 1972.
After identifying the patients, next you will do is to explain what is the purpose of the assessing the skin. Okay, sir, the purpose of assessing the skin is to detect if there is any possible abnormalities in your skin and to prevent in worsening. Next is to perform the hand hygiene. This is very important to prevent from contamination and spread of bacteria. Sir, is it okay to inspect you?
Yes.
Okay. The first thing we will do is to inspect the overall skin coloration. In order to check, you need to see if there is any skin discoloration, such as a jaundice with a color white, yellow, and pallor, which is color white, then the cyanosis, which is color blue, and the erythema is color red. Okay. Next is to inspect the vascularity of the skin, if there is any bruises, lesions, and infestations. Next is to inspect the lesion. Check if note the bruises, cuts, insect bites, and wounds. And if there is any present, take note the size, the shape, the color, the exudates, and also the distribution. Okay, next is to palpate the skin using the back of your hand to assess the temperature. And if ever, you use a gloves whenever you possible palpate the open areas of the skin. And the purpose of palpating using the back of your hand is to identify if there is a hypothermia. Next is to palpate for the texture and the moisture. The purpose of this is when the moisture is excessive, there will be a intensive sweating, and also the shiny skin that indicates the patient's dehydration. Next is to assess the skin turgor, which by gently pinching the skin under the clavicle. Okay, the clavicle is the only site that you can perform the skin turgor. We'll just gently pinch the skin, and when it reversed less than 30 seconds, that means that the patient is hydrated. When it don't reverse, or it will reverse more than 3 seconds, that means the patient is dehydrated. Okay, and next is palpate for the edema, which is characterized by swelling, gout, and also a shiny skin under the edematous area. Next is to inspect the nail angle if there is any clubbing present, as well as the color and the shape of the nails, and also palpate for the texture and capillary refill. Okay, first thing we will do is to press the nail, and if it goes back to the normal color, that means that the patient has a normal body circulation. Next is to inspect the head, or inspect the hair and the scalp. You use the gloves, you palpate, and if you notice that there is a lesions and the infestation suspicious, that means that the patient has a poor hygiene. Check the pattern of the hair, the growth, if there is any lesions or infestations, and if the patient has a dandruff, that means that the patient has a lesions or poor of hygiene.